Welcome to True Health Live, your favorite public health podcast. We are live on YouTube, Facebook, and audio on your favorite podcast platforms. If you're interested in public health, then this is the space for you. Welcome, peace, greetings, everyone. Welcome back to True Health Live, the show where we dive deep into health and wellness topics to help you live your best life. I am your host, Yafe, aka Deidre Sully, and today, in a somewhat unusual fashion, or we're just gonna kind of take a different turn for today's episode, we're actually going to do audio only. So welcome to our most recent episode, and we're talking about a few things. It's going to be a little bit more intimate. So we're not doing our live broadcast, but we're still coming to you audio, and it still will be uploaded to YouTube and all of the other channels. But unfortunately, we won't have the live commentary and the fun and the laughs, but definitely there's that opportunity to comment afterwards and send in your questions. You know, I always love to hear your questions and suggestions for topics that we could definitely cover. And again, this will be uploaded to all of our usual platforms, including YouTube. It'll just be a slideshow. And we'll probably premiere it. We'll see. But again, yes, I encourage you to ask questions as always. So instead of our usual live and our in your face kind of thing, it's just you and me today. And we're going to have more of an intimate experience as we are peeling back the layers, pun intended, on a topic that quite literally gets under our skin. Second pun intended. And that's bumps and lumps. So you got bumps? This is the episode to listen to. And why is that? Because skin is the largest organ on our entire body. Each one of us at some point has noticed something new on our skin, something that, whether it should be there or it's something that develops as a product of age. A lot of the times those things that develop still shouldn't be there. Whether it be a small bump or a noticeable lump, under the skin. And again, like when we're talking about like the bumps and lumps, there's a various array of things that it could be. And I know like the first thing that we think is like, some form of cancer, but we're not going to talk about those cancerous lumps today. We're going to talk about those things that are more benign, but we wonder why they're there. And when we say benign, meaning that they are non-cancerous, and things that can be removed or, things that you could actually live with. And what are they and what are some of the treatments? What are some of the causes and how do we manage that? And just kind of walking through why they even occur, at all. So we'll delve into like solutions from like, different over-the-counter remedies that, they have to professional treatments and, managing or even removing, skin concerns. And remember, while this episode, will provide valuable information, it is always best to consult with a healthcare provider for your personal advice and treatment options. So, and remember, everything is always a personal decision. So definitely make sure that you consult with your clinician or whoever your healthcare provider is. If you use more of a naturopathic method, always make sure you consult unless you are an MD yourself. So let's get into it. So like, what are the different types of skin bumps and lumps? And we'll talk about exactly like what we're referring to. So while, the skin bumps and lumps, they can be anything from small to almost imperceptible bumps to things that are more noticeable, lumps that can appear on our skin due to a variety of reasons. So let's break down some. We're not going to obviously go through everything, but we'll break down some of the most common types that we encounter. And the first up is like, we all go through it in some way, shape, or form. Some have, far better experiences during puberty than others, but it's acne. And it's probably most familiar from those, teenage years. They show up as small red bumps depending on your complexion. They might be red for those who have less melanin, or they might show up darker. Sometimes they're whiteheads, or they're even deeper under the skin, and they can be cysts. I know, like, I'm not sure about y'all, but I know I've had the experience with that under the skin pimple that never comes to a head, and it's like the most painful thing. Um, but in those type of things, like, so that acne, that stems from a combination of oil production, dead skin cells, and sometimes bacteria in our pores. Then we have like the cysts, and cysts are usually under the skin. So they're closed pockets of tissue that can be filled with fluid, pus, or other material being, if it's, for example, like an epidermoid cyst, it would be filled with different like debris of like overproduction of keratin, or dead skin cells and debris built up over a lot of the times hair follicles. So it'll also be, the different debris from the hair follicle as well. And they kind of, make a little cozy spot for themselves. I myself had a cyst, and it's just like, you think like, well, why do we get that? Like, where does that come from? So we'll get into some of those things, as that I was able to glean from the research that I did for this episode. And we'll definitely share some of the studies for you to look at, and those will be like in the discussion box on the YouTube page, and as well as the website. But cysts, they can sometimes feel like, like a pea, like a large pea under the surface. Sometimes they move, sometimes they don't. Sometimes it's just a bump. I know mine was on my back, and it's like, oh God, like, what a place to develop, right? And cysts can develop as part of an infection or clog in, sebaceous glands. So a lot of the times they'll use the term sebaceous cysts or epidermoid cysts and say they're kind of interchangeable. And technically they're not. People use them interchangeably, even in the clinical world, but they're not interchangeable, because the sebaceous cyst implies that there is sebum. It's basically made from a collection of sebum, which is a substance that our body secretes. Sebum is also like your earwax, it's in earwax. Like, that's an example of sebum and producing sebum. But that's you, and so that would be like, more fluidy or pus. That would be in the sebaceous glands. But an epidermoid cyst is, like we said, like the debris or the dead skin cells and things that haven't shed properly. So they just kind of collect, and a lot of the times, again, like around the hair follicle. And so far, like they say, well, we don't really know what causes them. However, based on some of the other research in dermatology, like, we can kind of put together why they might occur. So we'll talk about that. So moving on, another one is lipomas. So if you've ever watched Dr. Pimple Popper, she, has a lot of lipomas that come in. So lipomas are soft, fatty lumps that grow under the skin. They are non-cancerous, as well as a lot of the times the epidermoid cysts as well are non-cancerous. Very rarely are they cancerous, but if you find anything funny and it's making you nervous, always get it checked out. But lipomas are usually non-cancerous, and they're usually harmless. They are slow growing and can be located anywhere in your body. Cysts are also, a lot of the times, they grow slowly over time. Then we have moles and skin tags. And so for those of you who might remember like a grandma or something, like, with the tags on their neck. And none of these are things that should be growing. Like, none of these things are things that we should have in our bodies, but because they're so common and they're not necessarily life-threatening, they don't necessarily get the kind of attention that they probably should. Anything that grows on your body that should not be there is not necessarily a good thing, even if you can live with it, right? But moles and skin tags, and many people have moles, a few moles dotted around, or like a beauty mark on the face. And they can be flat or raised. They can be smooth or rough, and sometimes they have hairs growing from them. Skin tags, they're usually soft pieces of skin that stick out on a very thin stem. They're very common, but they're usually benign. And you can actually, kind of get rid of skin tags. Sometimes they might kind of slough off and come off naturally over time with exfoliation, but you should never try to just like clip them and, get them yourself. And if it comes off by itself, like naturally, or they kind of go away, that's fine. But, you want to make sure that you're not trying to pop a cyst or pop a lipoma or even pull skin tags because you could risk infection. You really should, go to a clinician or a dermatologist that can advise you in how to get rid of them or remove them for you. Many times skin tags are burned. They're cauterized off, which means they're burned off. And finally, not finally, but one of the last ones of the common, but this is less common, is keratosis pilaris. And so sometimes they call it chicken skin. And so this is for any of you who might have like those very small bumps on the upper part of your arm. Sometimes they're on the back or at the top of the buttocks. They're small, hard bumps that might make your skin feel like sandpaper. And they usually appear in your arms, thighs, or buttocks, and they're typically white or red. If you have lighter skin, if you have darker skin, they will have that darker kind of spine. Not spine, but a pillar, because it's keratosis pilaris. So it's a buildup of keratin. And that the name pilaris, like it comes up because they look like kind of horny spikes. So that's what keratosis pilaris is. But if you're darker, they won't necessarily be red. Usually on lighter skin, white, or the skin of somebody who identifies as white, they will be red. But usually on darker skin, they depending on that spectrum, what your skin looks like, they may be darker. But they usually kind of have that similar look where there's like patches of spiny bumps. But the good thing about it is you can really work it and get it down with like exfoliation and really thinking about the things that you eat and whatnot. We can get into that later. And so those are just a few examples. And while they might cause like discomfort or impact your self-image, it's important to note that most of these skin bumps and lumps that we just talked about are harmless, and there are others. However, again, getting them checked out by a professional is always wise if you are concerned. Don't let it just sit because you may not have identified, the bump or the lump correctly. And so those are some of like the primary types of skin bumps that you might encounter, but there are some, more that are less familiar with common skin issues like acne or mole. There are, several less common. And first, there's what they call like dermatofibromas. So those are small, hard bumps that form due to an overgrowth of your fibrous tissue beneath the skin. They often appear after like minor injuries like insect bites or thorns. They can be, again, depending on your skin complexion, they can be pink, red, or brown. And while dermatofibromas are generally painless, they can become a little itchy or tender when touched. Then there's what we call neurofibromas. And so those are soft, fleshy growths that arise from your nerves in your skin. They're typically benign and associated with a condition known as neurofibromatosis. And neurofibromas can vary in size and number. And while they're usually painless, their location can lead to discomfort sometimes. And so especially if they're pressing on something else, like they, depending on where they're located. So if they're pressing on another structure near a joint or a bone or something that is just not comfortable. Like if you lay on your back, maybe it's hard on your side. And it may be uncomfortable for you to like move around. And so lastly, there are things, and especially there are some people who just, are affected by this, and that's keloids. And so keloids, I would put that more in like the lumpy category because you notice, and sometimes based on the way your one's skin might heal. And so keloids are thick and puckered and itchy clusters of scar tissue, or sometimes itchy clusters of scar tissue that grow excessively at the site of a particular skin injury. So they go beyond the edges of the original wound and can continue to grow long after the skin has healed. And that usually you see that in people with darker skin. So a lot of the times it is African Americans or people who identify as African Americans or melanin dominant individuals, I should say, because there are more than African Americans who have dark skin. So melanin dominant individuals with darker skin tones are more prone usually to keloid formations. It doesn't mean that people who have lighter skin or melanin, um, way less melanin, or white people don't get keloids, because there are plenty of white people who do get keloids. But it is more prone for darker skin. And while they're not dangerous, they can, again, they can also be a source of discomfort or even like self-consciousness, because they become very prominent. Sometimes, you'll notice, specifically, men who might get haircuts, and if they use a particular type of tool or implement to cut their hair, like a razor versus clippers versus whatever else, it could, keloids and razor bumps, sometimes they call them razor bumps, can form either on their chin, like where their beard is, or in the back of their head. And you'll see that. And sometimes it can be, very prominent and create like a level of self-consciousness. So these lesser known skin conditions, they're not necessarily lesser known, but we just don't call them by their name. Like, plenty of people are dealing with these things, especially keloids. But they do highlight the incredible complexity of our largest organ. So while, keloids may not be as common or popular as like acne or moles, understanding that these conditions, all of them that we talked about, they can be crucial, especially if you're someone, you or someone experiences them. Again, I can't say this enough. Always consult with a clinician, and specifically a dermatologist, which is the clinician that deals specifically with skin issues. If you notice any unusual changes to your skin, because early diagnosis and management makes a big difference. So, because again, while something like a lipoma or a cyst can be slow growing, if you don't address it, they can become really large. And again, if it's in a place where it's pressing on something else, they can become quite uncomfortable. So, what are some of the causes and the triggers? And in my research, what I realized, a lot of the times, and we talk about this, or we have talked about it in other areas, it is and inflammation. It's a big one. So like, what about those causes and triggers? And that's a big question, why do we get it? And so what I learned is inflammation has a lot to do with it. While there are many sources that state research hasn't given us that why yet, inflammation, or the issue of inflammation, does show up a lot. Because it's a natural response that from our body's immune system, and it's a response to injury or infection. However, similar to how, chronic stress can mean, overproduction of cortisol and then start to affect us physically, right? And mentally. It's very similar, like with the inflammation. So chronic inflammation can lead to a range of health issues, so this is where we start getting into, what the body is naturally supposed to be in, or that, homeostasis, if you will. So inflammation can lead to a range of health issues. And that includes skin problems like acne, cysts, and other types of bumps and lumps. And research has shown that inflammation can be triggered by various factors, including genetics, environmental exposure, lifestyle choices, or even hormonal changes. So what are those, genetic predispositions? So we know genetics plays a significant role in how our body responds to inflammation. Certain genetic factors can make you more prone to conditions like acne or psoriasis, or both of which are characterized by inflammatory responses in the skin. The other disorder that we talked about earlier, like keratosis pilaris, they don't really know where it comes from, but they do think that and they means the scientific community, they do think that it does have something to do with genetics. So like, even though inflammation might be a big deal, because inflammation can cause an overproduction of keratin, which then, sets off a chain reaction. But there's a genetic predisposition for that to be the reaction in the body, which is, keratosis pilaris, which is where research is right now. Other things, the environmental factors, pollution, allergens, all kinds of things that insult our skin are common environmental triggers that can exacerbate skin inflammation. Exposure to pollutants can increase oxidative stress in the skin, which leads to that inflammatory response. And that can manifest in conditions like eczema or dermatitis, right? Lifestyle impacts. And this is the big part. Diet. Can't stress it enough. Diet, stress, and hygiene significantly influence inflammation. Diets high in sugar, dairy, and processed foods can contribute to systemic inflammation, which worsens skin conditions. Chronic stress elevates cortisol levels, which triggers inflammatory pathways and leads to skin issues. What are some of those? And you'll notice like a lot of these are also related. What are some of those hormonal influences? So, and I'm a woman, and as women know, like we go through a lot of hormonal changes. But everybody, men and women, we have those first like hormonal changes, like that big thing during puberty. That's, a big one. Pregnancy, menopause, all of that can increase inflammation and exacerbate skin conditions. We said it earlier, puberty. That's where we're experiencing that acne, So for instance, increased androgen levels during puberty can stimulate sebaceous glands, which leads to acne. So we can agree that the environmental, the genetics, the lifestyle, hormonal influences are all connected to, skin homeostasis. So one study showed that an imbalance of our, epidermal homeostasis or skin homeostasis can lead to cyst formation. So we talked a little bit about, what types of bumps and lumps there are, what can cause them. But a big part of it is like that psychological and social impact of skin conditions. Like we sit in there, we experience these things, or people we know experience these things, but then it's like, well, what does that do? Especially for those who might have bumps and lumps that are particularly large, or maybe they're while they may not be cancerous or life-threatening, they're definitely life-affecting, because maybe it's in a space where it alters another part of the body, or it alters how they can look. So, in that, there's some profound psychological and social impacts that skin conditions can have on individuals. So, and that's from self-esteem issues to social anxiety. The effects of skin problems, they go far beyond the physical. So what's that psychological impact? So many people, a lot of times we underestimate the emotional toll that skin conditions can take. So for example, story time, I have suffered from keratosis pilaris. And so for many, many years, I would not wear tops that showed my arms. Like I would at least have to have some sort of sleeve, because it was so embarrassing, because I couldn't figure out how to address it. And I noticed that when I lost weight and, really paid attention to exfoliation, it was a lot better. And then when I even switched my diet over to plant-based, it was a lot better. And I was more confident in, what I would wear, on my arms. Also cysts. So I recently had a cyst removed. And it was in a space where I wasn't too embarrassed about it, but you kind of get tired of the questions and the point of, what's that in your back? Like sometimes people are just not very aware of how they speak or what they point out. But, sometimes like, it's like, maybe they're just trying to be helpful, but other times it's like, I'm really tired of people saying stuff. So, that kind of creates, an issue, but sometimes it does push you to go see like, well, let me find out what this is. Right. But again, so like I was saying, like, we underestimate the emotional toll that skin, conditions can take. So like things like acne, cysts, keratosis pilaris and other skin issues, they can lead to significant distress. Some studies show that individuals with visible skin conditions are more likely to experience depression and anxiety. For instance, a study published in the Journal of American Academy of Dermatology found that people with acne have higher rates of depression compared to those without. Living with chronic skin conditions oftentimes means dealing with persistent feelings of embarrassment and self-consciousness because they're visible, and the visibility of these conditions can make people who are suffering from them feel isolated or judged. And that might lead to reluctance in engaging in social activities. How many of you have seen the commercials advertising pharmaceuticals for specific skin conditions? And that's literally what they point out is the person who is suffering from this given skin condition, because of course they're selling the pharmaceutical, but it's really the whole premise of the commercial is that social anxiety, or I don't want to go out and I don't want anybody to see me like this. It's a very real thing. It's just why they would make a commercial out of it. What about social impact? So social can be equally significant because they're related. People with noticeable skin issues, they often report experiencing stigma and discrimination. And again, like this would be like some of the more prominent things. Like, so there are people who have, who suffer from really bad acne, not necessarily just like a pimple or two here or there. There are some people who suffer from different disorders that create, painful bumps all over their body or in spaces where people can see. And it really does something to their self-esteem. Because again, I think we did a show earlier talking about snap judgments. It's no such thing as people like, well, I don't judge. People are looking and they're judging. And the recipient of those looks and judgment, they can feel that, But yeah, like, and that stigma, it can occur in various settings, workplace, school, even within your family. The social stigma associated with skin conditions, they can, impact an individual's quality of life, and maybe even lead them to be socially withdrawn or isolated. So like, again, like that person may avoid social gatherings, fearing, judgment, ridicule, or just, plain old stares. So, if you have a personal story about like skin issues that you may have, definitely feel free to comment on this story on the YouTube page, or, you can send an email to True Health Live as well. So let's talk about like, treatment, management, and like preventative measures, right? Let's explore some of that. And I'm going to start really like with but I'm not going to spend too much time on it because, again, this show is about, looking at all those health issues from like different angles, but always trying to, promote like what is more natural and holistic. But again, it is definitely a personal choice for folks. So if you want to go the more allopathic or traditional or conventional medicine, that's up to you. Or naturopathic or something in between. Most times I'm that person who's like in between, but definitely trying to do the more holistic and natural way as much as possible. Nonetheless, there's definitely over-the-counter solutions. So for like things like mild acne or even the keratosis pilaris, even there's no cure for keratosis pilaris, but there's different, solutions. So there's products that contain different, chemicals like salicylic acid or benzoyl peroxide. And they can be very effective in like smoothing out. I'm like touching my arm. Like, and this is audio. Nobody can see me. But they can be effective in like, kind of smoothing out those bumps. We definitely know of the many different mail away or mail order solutions that are available for people to use regarding acne. But a lot of the times, once you use them, you kind of have to keep using it for some of them. Now, they may have changed the formula where you don't have to stay on it for this, crazy amount of time. But in the past, it really has been like if you start using them, you kind of have to keep going because your skin kind of gets used to it. So, and there's also prescription medication. So things that are more severe they might require prescription treatments. So different drugs, they can, like retinoids, they can help with acne or keratosis pilaris by promoting cell turnover and preventing your pores from getting clogged, because that's really what that is. And again, but that's for specifically for the acne and the keratosis pilaris. And sometimes antibiotics may be prescribed to reduce bacteria and inflammation if you have cystic acne. When it comes to the cysts, that's where, like, things that are underneath the skin, that's where we move into like surgical options. So for things that are like persistent or bothersome, cysts, lipomas, they really require surgical removal. There's not like a topical thing that you can put on a cyst, because they're that skin waste, right? Or those dead skin cells, they're being, kind of collected, and they make a sac for themselves. So no cream can reduce that. You basically have to cut it out. Now, there are some things like ganglion cysts where it's like a buildup of fluid, and ganglion cysts usually form on usually form on joint areas. And you'll notice them sometimes, like a lot of times they form like near the wrist area, and that's like fluid. And sometimes that can go away on its own. But if it's like an epidermoid cyst or like a lipoma, they have to be surgically removed. And the procedure is usually straightforward and can provide immediate relief. And I can tell you firsthand that is very true. It provides immediate relief. And you just have stitches for a little bit. So what are, so some of the questions might be like, well, are there home remedies? Well, that home remedy would be a lifestyle change. So in addition to those medical treatments or the surgical treatments, there are lifestyle changes that can help manage and prevent skin issues. So that's, again, we said it before, diet modifications. So reducing those foods that increase or induce inflammatory responses can definitely improve skin conditions. So diets rich in fruit, vegetables, and healthy fats can support overall skin health. A really good skincare routine, establishing a consistent skincare routine is crucial, because again, this is your largest organ. It is actually the barrier for everything else on you. It is the cover for everything else underneath. I'm of a certain generation where we used to have to cover our books. And we covered our books because they had to be, and mainly most book covers, they would be brown paper bags, like the kind you get from the shopping, from the grocery store. And the reason was because it kept the actual book, like, and we would cover the hardcover books. It kept it newish, as much as it could be for the next use, because they would use textbooks for a while. But the whole point is it keeps the actual cover of the textbook pretty neat, so that you don't have the textbook getting, crazy looking. And so it's a similar thing with skin. Your skin is that protective layer before everything else. And your skin has several layers before you start to get to the things underneath, your nerve endings, all of that's like kind of deep underneath the skin, underneath the layers of the skin. So this is why a good routine and just being respectful of that, the largest organ, is really key. And what are like natural remedies to do that you can, kind of include in your skincare routine? Aloe vera, different oils, and being careful, because things like tea tree oil or peppermint or things like that, they can be really strong. You don't want to burn yourself. So, you can, put drops so it's good. It's awesome for the scent, for the smell, but it's also awesome to use, essential oils and things that are more natural and plant-based. Honey is a humectant. So it helps, with moisture, and also honey has anti-inflammatory and antibacterial properties that can soothe and heal skin. So incorporating some of those things into your skincare routines, as mask or spot treatments can be really good. But what are some preventative measures? And honestly, I think like diet modification is definitely a preventative measure, but preventing issues before they start is an essential part of maintaining healthy skin. So some strategies are, and this is an interesting one, so first is stress management. Chronic stress can disrupt your body's inflammatory response, leading to flare-ups. So, practices like yoga, meditation, or regular exercise can manage your stress levels. Hydration, that actually should have been number one. Staying hydrated, drinking water is the key to maintaining, barrier function and preventing conditions like eczema or like keratosis pilaris. Drinking plenty of water because you want to make sure that your skin is shedding properly. Because remember, the things like cysts, they're a collection of skin cells, dead skin cells that have not shed properly and building up around follicles. So like even all the things that happen on the skin, you want to make sure that you're keeping it in a certain state so that, all of the different processes are moving as they should and we don't have any mutations or things kind of moving in a way where they're not supposed to, which would lead to the abnormalities, right? We'll say abnormalities. And a big one that we'll always hear, sun protection. Now, I think this one is tricky because a lot of the times the information that we get about sun exposure and protection on that first search, like if you're, Googling something, it's generally best for those who have less melanin. You actually have to do a secondary search or be very specific. But if you just put in a general search about like sun exposure, it's not really the same for everybody because we're all different. And this is because like the lighter the skin, the less sun exposure needed to produce vitamin D. The darker the skin, the more sun exposure is needed because the sunlight has to penetrate. You have to stay in the sun longer in order for the sun to penetrate through darker skin in order for our bodies to produce vitamin D. So for some, exposure to those UV rays can exacerbate many skin conditions, including, acne or keratosis pilaris, and for those individuals, it's recommended that they use sunscreen, even on cloudy days. But here's the thing. There are many that would rather not put more chemicals on their skin to block the sun. Generally, like you could stay in the sun if you had like literally like no clothes on. Those with more fair skin could probably be in the sun. I think the average is around like 15 to 20 minutes and be able to produce the enough amount of vitamin C that they need to produce for that day. But those of us with darker skin, it's more around like 30 minutes to 45 minutes longer. Like, we have to stay in the sun longer in order to produce that amount of vitamin D. So, sunlight is good. Okay. I'll just say it like that. Sunlight is good. Regular dermatological checkups. So regular visits to your dermatologist can help catch and treat skin issues early or, treat those bumps. Look at those bumps, talking to them to figure out why you may have developed those bumps, and lumps, and they can provide that personalized advice and treatments tailored for your skin. And it goes to, we have to acknowledge, not everybody has access to that dermatologist. So if you or somebody you're listening to this and you're noticing that I've touched on, maybe you have one of those lumps and bumps that sound familiar, like whatever you've noticed on your skin could be one of the things that I mentioned. If you don't have a dermatologist, go to your primary care. Definitely get it checked out. Even if it means that you have to go to urgent care, get it checked out so that they can then refer you to go someplace and you can have a specialist look at it if it's something that needs to be looked at. Don't just sit with it because you don't know how large it may grow. If it's pressing on another structure, as I mentioned before, that could then exacerbate something else. So you definitely want to make sure you're getting those checkups. So with that, if you found this episode helpful, definitely pass it along to someone. It's really important that we kind of take a pause and look at the things that are going on with us. It's something as simple as a bump on the skin, those bumps and lumps, they while they may be what we call benign, sometimes there's still something that you want to make sure you check out and get it removed, address it. So we explored the various types of skin conditions or bumps and lumps that and the causes and triggers, and also like, the different social issues or psychological issues, or, esteem, more so issues that they may cause. And the diverse treatments and management and options available. We learned that inflammation is a significant factor underlying many skin issues, and addressing it through both medical treatments and lifestyle changes can lead to healthier skin. By understanding root causes and implementing preventative measures, we can manage and even prevent many of the common skin conditions that we see, and we can manage them effectively. So remember, like, maintaining healthy skin is not just about treating the symptom, but also about nurturing your overall well-being, like your regular checkups with dermatologists, balance your diet, manage the stress, make sure you're doing everything to reduce inflammatory responses, right? So again, if you found this episode helpful, please subscribe, please spread it along, follow us at True Health Live on social media, on all social media platforms. It's at True Health Live. Go on the website, sign up for insights and updates. We do more than just the podcast, and your support helps us continue bringing this valuable content. I would definitely love to hear from you. Share your stories and experiences with skin conditions on our social media channels. Your insights could help others going through similar challenges. So stay tuned for our next episode, and we'll see you then. Thanks for being part of the community. Remember, healthy skin starts with understanding and taking action. See you next time on True Health Live. Thank you for joining us here at True Health Live. Remember to like, save, share, and subscribe. Leave a comment and send an email if there's a topic if you want to discuss. You can follow us on Instagram, Facebook, and Twitter at True Health Live. You can also listen on DeirdreSully.com. If there's a topic you'd like to discuss or hear, you can send an email to truehealthlive@gmail.com. See you next time.